I'm Dr. Larry Garber. I'm an internist and medical director for informatics at the Reliant Medical Group, formerly known as Fallon Clinic. I'm going to speak to you today about a project called RAMPAGE, designed to improve transitions of care as patients are discharged from the hospital. Transitions of care are fraught with adverse events. In fact, it's estimated that 1.5 million preventable adverse events occur each year nationwide as a result of discharges from the hospital where patients' treatment plans are not followed adequately. Many of these are as the result of improper monitoring of medications or improper follow-up. With the help of an EHR+HIE grant, Meyers Primary Care Institute, under the guidance of Dr. Jennifer Chia, Dr. Terry Field, Dr. Jerry Gerwitz, myself and others, have come up with an intervention to help reduce these adverse events at the time of discharge. There are two components to this intervention. First component is to make sure that patients who are discharged from the hospital obtain follow-up visits with their primary care physician. The second component is to make sure that the appropriate monitoring of medications takes place. First, you need to understand that Reliant Medical Group does not own any hospitals. We, however, have set up interfaces to our primary hospital so that we know when patients are discharged from the hospital. We've also set up interfaces with our primary health plan that covers 60% of our patients and for which we're at financial risk for those patients. That allows us to have access to medication claims history on our patients within 2 days of them picking up the prescription from the pharmacy. Indeed, others who do this intervention could use SureScripts to get a similar medication history. So, for the first piece of our intervention, as patients are discharged from the hospital, we monitor that electronically through an interface engine in our electronic health record. And 3 days after discharge, the system looks into our electronic health record to see if an appointment has taken place or if a follow-up appointment has been scheduled. If no appointment exists, a message is sent through the electronic health record to the PCP's appointment secretary to schedule a follow-up appointment. 2 weeks after discharge, the system again checks to see if an appointment took place, and if none has taken place, a second message is sent to the primary care physician's appointment secretary. The second component of this intervention focuses on medications. A 2-round modified Delphi process with local physicians as well as national physicians was performed in order to determine what medication monitoring alerts should be invoked and when. The results of this process were integrated into the clinical decision support of the interface engine and the electronic health record, so that 3 days after hospital discharge, the system checks the medication claims on the patient to see what new medications have been started. Based on that, the system determines what the appropriate monitoring is and determines if that monitoring has taken place or is scheduled to take place. If it is not, a message is sent automatically through the electronic health record to the primary care physician, letting them know about the new medications and what lab monitoring should also be taking place that hasn't been scheduled. The system also notifies the primary care physician if there are any potential medication dosage changes that are necessary as a result of the new medications. We've been running this intervention for over a year, and the preliminary results look superb. We do hope that others will be able to take advantage of this intervention throughout the country, and that when their patients are discharged from the hospital, they'll be able to put them on a better and safer path. For the patient, I'm going to speak to you today about RAMPAGE, a project underway in Massachusetts to reduce adverse events during transitions of care. Currently, there are numerous adverse events that occur as patients are discharged from the hospital. I did.